All right, for those of you who don't know me, I think pretty much everybody does, but I'm Dr. Michelle Engel. I'm the owner of Columbia Animal Clinic. So welcome to Pet First Aid. So the first thing is setting up a first aid kit for your pets, and there's a big long list, like I said, and you actually should have that list in one of your handouts. We also are giving away two kits today. So I won't go over all of it. You have the list, but again, for future reference, you can also look at it on the website. Another good thing that you should have with you or in your first aid kit is some brief medical record history. And the first is, of course, vaccine and your heartworm and tick-borne disease screen and intestinal parasite screen status. That gives the date. Now, if you have our app, it's called Pet Page. It's actually there for you all the time. You just got to go on your pet page. If you forget that you need to go board your pet and you forgot to bring proof of vaccination, there it is. And you can show it to them. So it's very useful. It's got other things in it too, but for this purpose, that is there for you. Also, you want to have a list of the current supplements. A lot of times when we ask people what they're giving their pet, and they forget that they're giving fish oil or Pepsid or something like that. That's part of what we need to know, or an emergency clinic needs to know what you're giving your pet, and of course your medications. And the blue pill sometimes isn't really helpful, so writing down the name, the strength of it, so the number of milligrams on there, the dosage you're giving, so 1 tablet every 24 hours, is also helpful. And when you're nervous and upset because you have your pet in an emergency situation, you're not going to remember the medications, what their names were, even though you knew it 2 hours ago, and then you're not going to remember because you're all upset. So it's good to have it all written down and somewhere like purse or whatever. And any diagnoses that are important, like that your pet has diabetes or kidney disease, arthritis, little minor things like, well, he had a cut 2 years ago. No, but the important ones that your dog or cat is on chronic medication for is really important. And also any allergies or adverse reactions you've had in the past. So if your dog passes out from bee stings, that's important to know. Any food allergy or any supplements that you might have given that they had a bad reaction. So if you're concerned about, is my pet, feeling okay, and I'm not quite sure, here's a list of just the vital signs you can do. Heart rate, is it too fast? That can be because they're painful. It doesn't necessarily mean there's a heart problem, but they may be painful. And respiration and their temperature. In your emergency kit, you should have a thermometer specifically for your pet. And the other thing you can check is gum color, pink. When you press on the gum and then release, it should refill back up to pink again in a couple seconds usually. And then obviously blue would be bad. White could mean that they're very anemic or shocky. Brick red or yellow would all be bad. Easy thing to do, so what I do is, it's hard to count for a whole minute, so go for 15 seconds. You're counting the respirations or the heartbeat, and you multiply times 4. You're going to get how many beats or breaths per minute. So this is one of the first things on the list, because your pet may be wonderful all the time and would never bite anybody. But if they're painful and you're touching that painful spot, I don't care who you are, they can bite. It hurts, and in their mind, you're causing the pain and they want you to stop. So you need to protect yourself if your pet is painful. So there's a variety of muzzles here. That's a leather muzzle that we use here in the clinic if we need to. But there are also like a basket muzzle. If you really want to be proactive, get a basket muzzle that fits your pet ahead of time before you would ever think that you would need it, because they can pant, they can throw up with a basket muzzle on, and you don't have to worry that they're going to inhale or choke on anything that's in them because you had to muzzle them to do something else, like move them, put them in the car to take them to the emergency clinic. So, but if not, something like a shoelace. Used to be everybody had a shoelace. Now we have slip-ons, but a shoelace. The leash that we provided you also can work as a quick muzzle. And one of the staff will show you that at one of the stations, how to make a little slip quick muzzle for your pet out of that, or gauze is the other thing right there. And that is actually a cat muzzle. Most people probably don't see them very often, but we do have muzzles for cats. It covers basically their whole head, except for a little nose in the front, because visually, I think the cats do calm down better if they can't see what's going on. So, and also they can't aim at you as well. Okay, and how are you going to transport your pet? If you got a little one, great. Carrier, a laundry basket. Obviously, they have to be pretty immobile if there's not a top. But I mean, if they're dying, put them in a laundry basket, whatever you have, that's handy. But like this is just a blanket that you can use as a stretcher. If you have a board, you can something happens outside, you're playing with the kids, a dog falls through the ice, say as an example. The sled that your kid was just on makes a great stretcher. So it's whatever comes handy. A trash can lid. And there's leather gloves on there just in case, if you don't have a muzzle, if you, just to protect yourself as much as you can. That does not protect your face or other parts of your body that might be bit, but it might be something to have on hand. Most people keep a pair of gloves in their car for winter. Okay, nail trimming, not really an emergency, but it is when you've cut the nail and it's bleeding all over your house and the dog's running around the house. So you can have on hand some Quick Stop, and we do have Quick Stop in syringes. Where are those?
Tiffany has those, I believe.
They will be over there.
They will be over there. So we made you up a little syringe full of Quick Stop you can have on hand. I don't know how many we have.
50.
Enough? We got enough. Everybody gets one of those. Okay. So, but if you don't have Quick Stop, cornstarch works pretty darn good. Flour works pretty darn good. Worst comes to worst, you're outside, dirt. And then confine them. When they're running around, their heart rate is up and their blood pressure is up and they bleed more. So calm them down, put them in a crate, let them chill. Bleeding is going to stop. I have yet to lose a dog to a nail trim bleed. But if it's really bleeding, certainly a foot wrap is in order. And we're also going to show you how to do a foot wrap. Bee stings, isn't he cute? With a little swollen muzzle. Okay, so we've all seen probably the bee stings where the whole muzzle swells right up. But that usually is minor, and Benadryl works pretty darn good. And but it can lead to, if your dog's particularly sensitive, to like an anaphylactic reaction, like some people who are allergic to bees or other insects. So that can be vomiting, actually diarrhea also, and difficulty breathing because not just their muzzle swells up to collapse because they're not breathing, or they're actually, excuse me, or they're actually having an anaphylactic reaction. So a treatment for a mild reaction, if you can scrape the stinger with a stiff material, then you can get that off and then apply a compress of baking soda and water. That's just a little local treatment. And then if it's like the swelling like this, Benadryl with permission from your veterinarian if it's not me. And just in case if you're on other medications and we for some reason don't want you to have it, you should always check. But generally speaking, you can use the Benadryl at about 1 milligram per pound. So it's a lot bigger than you think. So if you have a 12-pound Yorkie, that's kind of a big Yorkie, but anyway, 12-pound Yorkie, that's a half of a tablet. And you know you're sleepy at a tablet, right? When you take a Benadryl, your dog will not be that sleepy. So don't worry. Okay, vomiting. I love this picture.
Well then.
I cannot take credit for this picture, however, unfortunately, but I do love it. Generally speaking, if you know they just ate something that upset their stomach, it isn't something toxic, fasting your pet from food and water for about 12 hours, and then offering a small amount of water frequently after that. And if they're not vomiting, then you can try something like a bland chicken and rice or hamburger and rice. So if that's not working and they're vomiting through this whole 12-hour period, do not wait 12 hours. This is, I vomited and now I'm going to wait 12 hours before I get to eat again. Okay, not I'm continuously vomiting for 12 hours. So I know it probably sounds obvious, but sometimes you have to say the obvious. Diarrhea. That's the best picture I could come up with. It wasn't gross.
That isn't necessary.
True.
What?
She said that is not diarrhea though.
No, we'll call it cow pie. Obviously, if they're having diarrhea for an extended period of time, that is, they're going to lose weight. They could be dehydrated. And so this is a short-term diarrhea, not a long-term diarrhea. Again, you can go with a bland diet, or sometimes we will prescribe you like a kale and pectin paste or a probiotic to get it back on track. But if that's not working, obviously we need to see the pet. And this is, of course, they're feeling fine otherwise, not sick and diarrhea. So a dog feels fine, it's wagging its tail, it wants to play, but it has some diarrhea. Okay, so bloat. I'm not going to go into a big long thing about bloat, but common breeds for bloat would be like a Great Dane, German Shepherd, Standard Poodle, Doberman. There's probably others that I'm not thinking of right now. But if you're a large breed, deep-chested dog, the bit dogs who are really narrow and long-chested are the breeds that are most predisposed. And so it is an immediate emergency, and that's why it's on here, rather than go through the whole process of the disease. And that is, if your dog all of a sudden is barrel in the belly and they're pacing the house, uncomfortable, they may be trying to vomit, yet nothing's coming out. That's because their stomach has rotated, which is basically taken the two ends and tied them up so that the gas in the stomach is not going anywhere. It keeps getting bigger and bigger and bigger. It's very painful, and it is an immediate emergency and needs to go to an emergency clinic for surgery. Really, it's like within 2 hours. So it's not a wait and see thing. If it's bloat, it's bad. It needs immediate attention. I think I covered that. Okay. Dehydration. So how do you recognize that your poor sickly kitty here is dehydrated? And that is, aside from a really old cat who doesn't have any elasticity to their skin anymore, like that's why we get saggy skin and stuff, but is when you pull up on the skin, you then it just kind of sticks there and then slowly goes back down. That's a pretty darn dehydrated animal. Other things, again, would be like sunken eyes. When you lose fluid, you're 75% of your body is fluid. Or, yeah, fluid, water. When you lose that fluid, you shrink like a raisin. So your eyes are going to sink in. You know how you get cotton mouth, like if you've eaten too much salty food. So you get dry gums and thick saliva. So you can check the gums also, not just the tenting of the skin. But if you can tent the skin and it doesn't go down, they're dehydrated. They need to be seen. Like I said, sometimes on the old cats, that one's a little bit tough, but that's just a general rule. So what you can do, if they're no longer vomiting and that's why they're dehydrated, you're going to give small amounts frequently of water. It doesn't have to be, generally speaking, it doesn't have to be anything fancy. Water. You don't need Gatorade or electrolyte solution most of the time. Water is fine. Sometimes I'll say give a chicken broth or beef broth just because it's flavored, so they might be apt to drink a little bit better, a little bit more. Okay. So poisons. We can't go through all of the poisonous plants. There's a myriad of them. The good thing about it is most of them are just going to cause some minor stomach upset, maybe some drooling because it tastes bad, maybe some vomiting and diarrhea. So most of them are not going to cause death, but some of them might. So, and these are three that are important ones. The poinsettia, Easter lily, and holly. So on here, this right here is ASPCA poison control. So you can call them and they'll guide you. They'll ask you like how much was ingested, how long ago, and all that kind of stuff, and give you advice. It is $65 a call though, so be prepared when you call. They're going to want money, it's legitimate. They have people staffed there for you 24/7, so you have to pay for it. However, if you have a Home Again microchip, which that's the one that we do here, and you pay your membership fee, so the first year is included in your microchip placement, but after that, then they send you a bill that you don't have to pay because you're still on the registry. Your pet's going to be found. All your information is there. Okay, so you don't have to pay the membership fee for that. It's for the other stuff, like helping you find your pet if it's lost and the poison control. So I got my renewal just the other day and I actually read it. And your Home Again membership of $21.99 per year includes calls to the ASPCA hotline, poison hotline. So I feel like I'm selling something, but I'm not. I'm just saying that it may be worth it to you to keep that membership so that if you need to call, you're not paying $65 per call. It's free to you. Also, there is an ASPCA app, which is free. So you can have it on your phone. You don't need to pay $65 to call them and ask. You can say, type in what is this toxic to my pet? And you can look up that particular plant or whatever right on the app. So you don't have to pay any money for that. It's right there available to you on an app. Oh, and that right here is just if you go on the website there is a whole list of toxic plants on that website right there that you can look up also. Household poisons. So there's a whole bunch of them, and again, I can't go over all of them. However, you want to recognize that some of the things that are in your house are toxic, like they're small children. Your pets are small children who get into everything, and you may even want to put little lock things on your cupboards, because mine like to counter surf and occasionally get into a cabinet. And also things like Tylenol, ibuprofen, and aspirin. Now, yes, sometimes we do use aspirin, and on a really rare occasion, we'll use Tylenol for a dog, but that's really, really rare, and only because we ran out of other options usually. But Tylenol is toxic to your cat, it will die. And ibuprofen is really bad for your dog and cat. Aspirin is bad for your cat. You do a one-time appropriate dose of aspirin, sometimes that's okay. And of course, your prescription medications, that just happened to a staff member recently, so it happens. The animals get into things that you thought you put away, and they found it. Oh, there we go. Okay, chocolate. So chocolate can cause hyperactivity, heart arrhythmias, vomiting, and seizures, and pancreatitis. So we all know, most everybody knows chocolate is not good for your pets. So on here, I just so you have an idea of volume of things that you need to worry about. So here's this 10-pound dog, and the cocoa powder that you're using for baking that's it. It's just cocoa. There's no sugar, nothing in it. At as little as a half an ounce on a 10-pound dog, they're severely ill. Just 3/4 of unsweetened chocolate, you're going to have severe illness. Then 3/4 of dark chocolate, you're going to have mild to moderate signs. So it's basically the amount of pure chocolate that's in there. So you get all the way down to milk chocolate, 1.5 ounces. You're going to have mild to moderate signs. So all chocolate is not equal. The darker the chocolate, of course, everybody's going for darker chocolate now because it's supposed to be better for you and actually good for you, is now going to be worse for our pets if it's laying around. Now, just for comparison here on a 60-pound dog, for milk chocolate, they can eat basically a whole one of those regular bars. Probably not a whole lot's going to happen. Maybe vomit, because that's a lot of sugar and stuff. So just for comparison here. Now, there is a myriad of websites. If you just Google chocolate toxicity calculator, it'll come up with 5 in a row. They're all about the same. I looked them all up. So rather than try to figure it out, was it dark? What was it? Those sites will show you it'll say what's the pounds of your dog, what kind of chocolate did it eat. You click the button, and then how much did it eat? You put that in, and it tells you if it's bad or not. Okay. If you know that they just ate it, generally speaking, again, I would call just to confirm, if possible, that you got the right amount and so on and so forth, and that it's okay to give hydrogen peroxide to your dog, but it's a 1/2 to 1 ml per pound of body weight. 5 mLs is a teaspoon, 15 mLs is a tablespoon, 30 mLs is an ounce. just for reference. Okay. Xylitol. So everybody knows what xylitol is, artificial sweetener. More and more stuff are containing xylitol because everybody's trying to have less sugar. I don't know if that's helping, but so these are all the things that can be, xylitol can be in. Breath mints, the baked goods that are like sugar-free or low sugar, cough syrup, chewable vitamins, mouthwash, which was I didn't think mouthwash would have that, but it does. Some toothpaste and some nut butters. That didn't used to be that way. It used to be chock full of sugar. And now some of those low calorie nut butters will have xylitol in it. So please check your peanut butter labels because dogs like peanut butter. We feed it to them. We bribe them here with peanut butter, but not with xylitol in it. Certain over-the-counter medications and dietary supplements and sugar-free desserts. I love that picture. Okay, so grapes and raisins. The thing about grapes and raisins, I don't have to read it to you. The thing about grapes and raisins is we don't know how much is too much. And we don't know which dog is going to have a problem with it. And they're not really even sure why. We just found out that it's a problem and we need to not give it to them. So basically make the assumption that grapes are bad, raisins are bad, and if they eat them, make them throw up or call us if it's been a while or whatever. But just assume that one is bad because we have no idea how much is too much and we don't know which dog's going to get sick. Seizures. So this can be for a variety of reasons. Most of the time we're going to say we're going to talk about epilepsy for the most part. So you do not want to put anything in your dog's mouth. You don't want to, hold them. Basically, you want to clear the way and let them do their thing. It lasts not as long as you think it does because time goes by very slowly when you're watching your pet seizure. So most people have a phone on them nowadays all the time, but clock in the room, look at your watch and time it. And if the seizure, just write down how long it lasts, then give us a call, tell us what happened. And if it's a constant, obviously if they're not coming out of their seizure, usually it's 30 seconds to a minute, maybe 2 minutes tops, and they should be done. If they're not, you're putting the dog in the car or cat, it's usually a dog, but taking them in because it's what we call status epilepticus. When they're not coming out of their seizure, they are just burning up. That's a lot of movement, and their temperature goes higher and higher and higher, and it can go so high they're basically frying, and they can go into a coma and actually have brain damage. So that's why we want you to time the seizure. A lot of times people say, I think it lasted 5 minutes. And usually it's like 30 seconds to a minute. It just seems like forever. Okay. So if your pet is choking, this is really difficult for me to tell you what to do because I don't want you to get hurt. Here, your pet is choking and you're going to be sticking your fingers in your dog's mouth. And that doesn't sound like a very good idea. So you use caution, use gloves, use a spatula or a wooden spoon or something if you can see it to try to pull it out. But, sticking your hand down there, you can get bit. 2, you could shove it in farther. So you need to be very cautious about how you're addressing a choking problem. I don't think we have, do we have, there might be tweezers, but not something big like for a big dog, but something to have on hand that you could put, even like tongs, like the little loopy tongs, not the, to pull something out if you see it, something like that. Or it basically kind of a dog Heimlich, which we can go over at the CPR if you guys want to do the little doggy Heimlich along with CPR there. But it says right here that you're basically pushing close to the same place as you would for a person to try to dislodge it out for them, just like you would with people. Rather than, if you don't see the object, don't be sticking your hand down there. Like I said, you could make it worse. So, overheating. If overheating is one of those things where, and I have personal experience with this, we were in a parade, and it was with a friend of mine's bull mastiff who was pulling a cart. It's pulled a cart before, it's not a problem. We turned the corner, and two large buildings on both sides, no air. And the dog got overheated. We took him off the cart. But what happens is when you think they're overheated, then they get worse. Like you think, you solved the problem, and you stopped, and they just get hotter and hotter and hotter. So just keep that in mind, that even though it's like, oh, I stopped, I let them rest, they're still overheating because they're not able to cool themselves very well. So you want to move them to a cooler location if possible. Use cool but not cold water. You don't want to shock them with too cold of water. Then if they are aware, you can offer small amounts to drink. But if they're really out of it, and sometimes they really are, don't force it. They're going to inhale, and then they can get aspiration pneumonia, and you don't want to do that. But you should have a thermometer in your kit, and you want to take the temperature every 5 minutes. And you want to stop when it's 103 because they're overheated still, but it's a safe overheating. Because what happens is you've been cooling them, and usually they continue to get cooler even though you've stopped. But you're still checking the temperature, because if it goes back up, then you resume your cooling. But you don't want to cool them so much and so fast that then you're making them hypothermic later on down the line. And obviously, overheating is something that you do not, minor, but if they're down and you're having to cool them like that, you need to take them in, because there can be secondary damages that occur from that we need to address and make sure that they're not having. So you do still need to, this is like the immediate thing, cool them down, but then still bring them in so we can make sure that there's not any secondary changes, organ dysfunction that is going to occur because of the overheating. Okay. Hypothermia, dogs have a lot of fur, so it's not too much of a problem. But if you have any frostbite areas, like with people, your skin's going to come off if it's frozen. So you just want to warm them up, the whole body, and obviously bring them into hopefully a heated environment, and warm them up with like blankets from the dryer. A heating pad is a little, I hate to do that, but if you have a couple blankets in between the heating pads so they're not going to get burned, you can do that. Hot water bottle, again, you got to be careful with that. If they're down, they're not moving away from a hot object, so be very careful with a hot water bottle too. Put it on you and rest it on there for a while, and if you're okay with it, they should be okay with it. If their temperature is below 98, do these things, but bring them in, because we're going to need to slowly warm them up, probably give them fluids, and, make sure that, again, we don't have organ dysfunction from being cold too long. Again, once the temperature is above 100, you can take all that off of them and keep monitoring it, but then because you don't want them to get overheated afterwards. And then, like I said, you're still going to monitor their temperature every 15 to 30 minutes until they're basically behaving normal. Okay. Drowning or near drowning. If the dog is conscious, then you're just going to want to pull them out. Usually, it seems like the drowning occurs when the dogs fall through the ice. So generally speaking, they're cold. So you got to combine your drowning with, warming them up. And we do want to have you bring them in to observe so that we're making sure that they're not getting any respiratory issues. At first, it seems like they're okay. But then the raspy breathing can occur later on, so they should be monitored. If the dog is unconscious or non-responsive, then you're going to lay them down on their side. Try to have their head slightly lower so some of the water can passively come out, clear of any objects. Go back to the choking slide. Now, if they're unconscious and you think they've drowned, really, what's it going to hurt to try to, get rid of some of that fluid? But it's not a Heimlich type thing. It's like a gentle pressure on there to relieve some of that. So don't get worked up and pounding on them. Just release some of that fluid, hopefully. Obviously, you want to check for a pulse. If you don't know where to look, the staff in the back can help you with that at one of the stations. And begin CPR, which we have our CPR dog somewhere over there. So we're going to show you some CPR. And then also artificial respiration. And then you want to keep the dog warm during this time and then obviously transport them over. Just so you know, CPR is almost never successful in the long term. It's great. I guess, what does it hurt to try? But really don't expect that you're going to have a good outcome. Even in a hospital setting, if there's no heartbeat or respiration and it just happened, I don't remember the statistics, but it's not very high. In a, out at your home setting, it's close to zero. But again, if they're down, it doesn't hurt to try. But just keep that in mind. So, bite wounds. You should assume that all bite wounds are infected. Mouths are dirty. And so if you clean it up and you're like, oh, it's just a little puncture, it'll be fine. What happens is 5 days later, half the skin has fallen off the cat because all that simmered underneath. And then it separated the skin. So now all that skin on the top has now died, and now you have this big gaping hole. So, that is more of a worst case scenario, but happens all the time. So bite wounds should almost always have antibiotics and be flushed and that to get all the nasty mouth bacteria out of there. Okay. Hit by car. Every hit by car is an emergency. If they just got bumped and they seem fine, you should still have them checked out and monitored, and you monitor for the next 48 hours. Because sometimes that's internal injuries that are waiting to happen that you can't see and that we can't see. Not initially. Sometimes it's a slow leak or something. And so they look fine, but you still want to monitor and make sure because that stuff can be simmering under there, and you only see what's on the outside, not what's going on the inside. So always have them checked out and make sure, and then still monitor them yourself, even if we think they're fine, for the next 48 hours to make sure that no new symptoms are occurring. Okay, fractures. Again, I have muzzle on here a lot, and that's because you can't help your pet if you're injured. So, they'll forgive you later if you put a muzzle on. Then you're going to lay them on a flat surface because you don't know what's broken and what's not. Hips, back. So we want to try to maintain everything on a level surface if you can. If you can't, a blanket still is better than trying to pick up and having both ends hang off and, that type of thing. So a blanket keeps them relatively flat when you're trying to transport. So splinting, whether or not to splint, generally speaking, don't splint. You may be splinting it so that it's cutting off circulation. You may be more apt to get bit, obviously, trying to splint, when you're just better off leaving well enough alone and transporting them gently the way they are. Occasionally, there's something flapping in the breeze and you're like, we got to put that somewhere, and then kind of, gently stabilize that because it looks like it's about ready to fall off or something and you're freaking out. But so yes, sometimes, but generally speaking, you don't know what's broken and what's not broken. And so just keeping them, on a flat surface and minimally handled is probably the better way to go. So bleeding, again, muzzle. Hold, now if it's, like they ran through the woods and came back with a cut and it's bleeding, direct pressure. And direct pressure, again, break out that timer because 3 minutes is a really, really long time when you're sitting there holding something. So the tendency is to go, okay, how's it doing? Okay, how's it doing? Oh, there's blood in there. Let me get it out of the way so I can see. What you just did was blow off or pull off the clot that you just tried to form. So you'll be tempted to do that, but try not to do that. Just gently pressure and just sit there and hold it. If it still doesn't stop, depending on where it's at, you might be able to do a wrap or you may have to put a tourniquet on. If you have a gusher and you feel like you need a tourniquet, you probably do. But you do have to loosen it because obviously you're stopping circulation to that limb. Usually it's the limb. And so you don't want to lose that limb if at all possible. So you'll have to loosen it and tighten it while you're getting them to an emergency facility. Internal injuries, bleeding from the nose, mouth, rectum, coughing up blood. Some of them you just don't see. If you're bleeding into your belly, it may be looking a little bit bigger, but you don't necessarily know that. Sometimes you'll get, like you press on the belly and you'll get a little fluid wave, but there's got to be a lot of blood in there for that. So that's why, like I said, on a hit by car, assume that it's got something wrong with it and bring it in because you just never know. Burns. I didn't want to show you nasty burns. So again, muzzle burns hurt. I don't think my husband's here, but he can attest. He just burned the whole top of his foot off with hot boiling water. The skin came right off. And it hurt like for weeks. So it's very painful. So again, you just want to flush with water. You don't need to, don't pour other stuff on there because it'll burn even more, but just water. Now, if it's a heat burn, you can use like an ice water compress. If it's a chemical burn, again, you want to flush with water and bring whatever it is that they got burned with. So, the whatever emergency facility, or we know what they were burned with. Also, it may seem okay, especially with animals with fur, because it looks fine, or it might be a little red and that's it. But then in about 5 days or so, you have a nice little crunchy piece of skin there because it's dead. So the burns, you won't see necessarily all of the damage right away. Death of the skin is really evident by then. Shock, low body temperature. Again, you have your thermometer, a weak pulse, shallow breathing. It may be a slow heart rate. It may actually be a rapid heart rate, depending on where they are in their trying to die part. It usually follows like a hit by car, or in cats, high-rise syndrome. They jump off the balcony and chasing something. You want to keep them warm and quiet, and then transfer them immediately, because there's really not a whole lot you're going to be able to do at home except keep them warm and quiet and bring them. The thing about animals that are like in shock and trying to die, the more you mess with them, you can actually take them over the edge. So don't try to do too much at home, because even in our facility, you got to do minimal at first. Just try to get them warmed up, or even trying to set a catheter or trying to take an x-ray. They'll die because they're barely hanging on, and then you mess with them a little bit and they go the rest of the way. So don't try to do too much to them, because you might take them over the edge just trying to be helpful. Okay, if they're not breathing, make sure that they're unconscious before you're going to be breathing for them. Make sure that there's nothing in their mouth that is choking. Go back to choking. And then you're going to do, if you choose, you're going to do basically mouth to mouth, and until you see their chest expand. And we have the dog model that we're going to be demonstrating that with. So they'll go over that more detail. Again, no pulse or heartbeat. I'm not going to go over all that. They're going to go over probably most of that, and then you'll have that on the website for your reference. But again, it probably won't be successful, but might as well try. All right, that's where I got some of my information. Actually, you can go on to avma.org, and they got lots of information for the layperson about pet emergencies and a bunch of other stuff too that's very interesting reading, and also the ASPCA. Veterinary Partner also has a lot of client type information on there too. And thank you all for coming. Like I said, it'll be available on our website. We also have Facebook and Twitter. If you're not there watching us, we have some fun things that we show on there. And again, if you want that information on your pet's records and stuff, go to the pet page. Thank you.
Thank you.